Stonemasons and brick masons both work with stones, bricks, and sometimes mortar to construct or repair walls, floors, walkways, and other structures. They may carve or shape the stones and brick in some way, or may use them in their natural state. Stonemasons work with artists, architects, landscape designers, and even archaeologists to analyze the use of stone and brick in modern and historical construction. Prior to the mid-1970s, asbestos was frequently used as insulation and a fire retardant in buildings. Anyone involved in the construction industry was exposed to asbestos in one or more of the many products it was used in. Stone and brick masons would have seen all those applications and may have worked with it more directly as an additive to cement that both increased cement's strength and increased its insulating capabilities. During the 1970s and continuing to the present day, more and more restrictions have been placed on the use of asbestos. Over the past 30-some years, its use has gone down considerably. However, stonemasons, brick masons, and other people who were involved in construction may only now be showing the effects of exposure that occurred decades ago. The risk has not gone away, however, just because asbestos is not being used in modern construction. Many times, stonemasons and bricklayers are called in to remodel older buildings, to repair chimneys that have been damaged over the years, or to assist in demolition of old structures while protecting the stones or bricks for reuse in any new construction. Anytime workers go into an older structure, there is a potential for asbestos exposure. Since asbestos does not break down over time, the fibers are just likely to rise into the air during a remodel as they were during the initial construction of the building. Modern regulations require very careful handling of asbestos and the taking of special precautions to keep these fibers contained. These regulations aren't always followed, however, and the stonemason might go on to a job not even knowing there is asbestos on the site. Asbestos is a mineral that has immense natural fire retardant and heat resistive properties. It also has a tendency to slough off very small fibers when it is disturbed in any way. These fibers are so light that they float up into the air and can even be blown long distances. Anyone who happens to breathe in the contaminated air gets asbestos dust fibers in their lungs. When the fibers get into the lungs, they irritate the lung tissue and gradually cause scarring. Asbestos is also a carcinogen. Malignant mesothelioma is one of the worst forms of lung cancer with a very low survival rate. Asbestos-related diseases, including mesothelioma, take years, even decades, to develop. When symptoms do show up, they are usually mild and written off as something else. Early symptoms are generally limited to shortness of breath while exercising, eventually getting worse to the point of causing shortness of breath and mild pain even while the person is at rest. By the time symptoms are severe enough that people seek medical attention, the mesothelioma has often spread throughout the body. If caught early, usually as a result of an unrelated medical exam, doctors have had some success at surgically removing the tumor. But once it has spread, surgery is less effective. At this time, there is no cure for mesothelioma. Doctors can only treat the symptoms of advanced mesothelioma, and they can try to slow its growth by administering chemotherapy or radiation. Because early detection is so difficult, but so important, anyone with asbestos exposure should get a thorough medical examination. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net, information and help for patients and families.